This has been a troubling question to me as a dad, as well as a physician and brain researcher. We've noticed, and I have young teenage and 10-year-old son, that it takes longer for a child or even a teenager to recover from a concussion than it does from a 20-year-old. And what we've seen on average is that you want to, under the new pediatric guidelines, not let anyone practice, have physical or mental exertion after they've had a brain injury if they don't recover fully afterwards, say for a concussion. Then they're to rest entirely. Then after that, they can exert themselves and be tested again and make sure they're back at baseline before you let them go back into practicing or playing. It seems, in general, it takes twice as long for teenagers and young kids to recover than it does for kids or adults in their 20s and 30s. Now, in terms of long-term effect, there's two things at play here. One, if you're 25 years or older, your brain's pretty much fully developed in terms of the connections that are there. And so you're using most of your brain. Let's say you're a 12-year-old and you get a head injury, and you're not using a part of the brain that may be injured during a concussion. You might look pretty okay at that time, but when you're 18, or you need that brain area to kick in or to do something, we now see that the damage that occurred before is now showing itself. So what we're looking for long-term is what you have acutely is a problem that we recognize and keep following people up to see if that acute problem still is present or if later on down the road, long-term, we see a new problem emerge. So while it's a little bit complicated of how we're looking at kids, we have to keep in mind that their brain's not fully developed yet. So you have to keep an eye on it, I think, longer in terms of seeing what's the end of the game outcome of things.